morning, everybody. Thank you, Seamus, for inviting me to represent the Katharine Howard Foundation and to address you on this topic. A bit daunting, to say the least, given the cumulative experience of people in this room. However, I think it is a discussion that is to be welcomed, especially in terms of including organisations from such different backgrounds as we have today. It is really important to share perspectives on both the challenges and the opportunities faced by all involved when it comes to assessing impact. In the hope of adding to the discussion this morning, I'm drawing on experience of working with the Katharine Howard Foundation, and in particular with the recipients of grants and participants in projects over the past 15 years. In addition, I am lucky that my work has also allowed me to participate in and learn from the way many other funders assess the impact of their work, and that would include some of the work that has already been spoken about, particularly by John. In many ways, my own experience mirrors the enormous range of approaches that have been developed in this broad social sector. As was said earlier, the driving force behind all the efforts to assess impact is the yearning for learning and the belief in instigating change based on that learning. As primarily a small grant maker, Katharine Howard Foundation strives to ensure that its resources are put to the best possible use, and thereby we maximise our impact. Assessing impact is not new in terms of my view, and I feel some of it is in terms around what language we use in relation to what we now do. But I think it has been around for a long time. The concept was developed and tweaked over the years. Initially, it was focused on the ways organisations evaluated their work and was closely related to accountability and monitoring. This was expanded to include the famous pilot phase, where the emphasis was on piloting and demonstration projects and extracting the learning and influencing policy. In more recent times, there has been an emphasis on gathering evidence about what works and learning how to apply that to all sectors. In many ways, this was seen necessary due to what was called the implementation deficit and the need to understand what needs to be put in place to effect real change. Finally, the recent focus of the social impact bonds by way of increasing investment in prevention and early intervention is seen as an opportunity to ensure that investment is front-loaded where it might have the most impact. As already mentioned, the reason KHF tries to assess its impact is based on the responsibility on all involved with the Foundation to ensure maximum positive impact from its resources. We try to do this in the course of our work so that it is a seamless approach. The startup of any new initiative or project includes a recognition that formative evaluation, where possible, by which we can reflect continuously and learn from the successes and challenges, is most suited to the work we do. What we ask of our grantees is determined by the scale and thereby the proportionality of the activity involved. We have been very impressed over the years with the recipients of our small grants and how willing they are to share their learning and tell their story. And we feel that people are very open to looking at what tools that we require them to use in terms of assessing their impact. As the Minister and John have mentioned, the early intervention sites that Atlantic Philanthropies along with the government are supporting. And I happen to be very involved in one, which is a childhood development initiative out in Tala. Really, if you like, upped all our game in terms of the learning that was available and the types of expertise that was brought into evaluating the implementation of early interventions. And there is indeed an enormous amount of learning arising from this and the other prevention and early intervention sites. It is clear, though, and you all know this, that change takes a long time and that the support and capacity of the workforce is critical to the delivery of quality services. Some of the evaluations involved random controlled trials, and even though these were a hard pill for many to swallow, it resulted in much learning and increased capacity and understanding around rigour when it comes to measuring impact. The community and voluntary sector is under a lot of strain within the current economic context. This strain will affect organisations in various ways, depending on the scale of those organisations. However, all organisations benefit from being able to clearly articulate their vision, how they plan to achieve their objectives, and finally, how they will know when they have made an impact. In my view, funders may assist organisations by providing clear policy in terms of what is expected of them by way of reporting and sharing the learning. This sharing works in both directions, and a mutual respect for the knowledge and experience of both sides is an essential starting point. So to sum up, and I just want to reference that a lot of my learning around reflective practice has come from our work in the early years education and care sector, which is one that is quite marginalised and invisible, but in fact they have been doing reflective practice for a long time, and I think it's one that does connect to the quality increase in the sector. So the importance of reflective practice to include planning, evaluation and assessments. I think it's essential to be proportionate in terms of what is required in terms of measuring impact. It is essential for foundations and other funders to be clear and transparent in relation to their vision and objectives. Finally, assessing impact can be a complex undertaking as it is very difficult to attribute a certain input to a certain outcome. For this reason, it is imperative to use a number of methods, including a range of variables, depending on the context, so that a montage can be created which fills out the full picture. My final word is that measuring impact depends ultimately on what you want to achieve and how you might know whether you have achieved it or not. Okay, thank you.